Welcome back to the OHSU Effect. I'm Lacey Evans. People may not be aware that besides from the traditional Western medicine, OHSU also offers a wide array of Eastern medicine like acupuncture, Oriental medicine, and naturopathic care. These services are helpful when used alone, but when paired with other forms of healing, they treat the mind, body, and spirit. With me now is Dr. Lynne Shinto. Good morning.
Good morning, Lacey.
So you are involved in integrative medicine. What does that mean?
Lacey, that's a good question. Everybody asks me that. So my definition of integrative medicine is it's really a partnership between the patient, their conventional doctors, and their alternative doctors. And we're all working together to get the best care for the patient.
And at times, these two kind of worlds of medicine have been at odds, but I mean, that's not really the case as you've seen, correct?
So I think in the past, the two worlds have not interlapped very well, but I think this is not the case now. I think an example of that is OHSU, where we actually have integrative care, where conventional doctors and naturopathic doctors and acupuncturists all work together to improve health and wellness for their patients.
Well, tell me about some of the treatments that are available at OHSU.
So at OHSU for integrative medicine clinics, we have acupuncture and Chinese medicine. We have naturopathic medicine, and we have lifestyle counseling.
So in what kind of conditions do you treat with both types of medicines?
We treat a lot of conditions, and I want to just add that it's not just about treating illness, it's about preventing illness. So sometimes people come in and they don't really have anything wrong, but they want to prevent getting hypertension or high cholesterol or diabetes. So in that case, we work on lifestyle like diet, stress reduction, using mind-body techniques to help someone keep healthy. In other cases, we treat a wide variety of chronic illness, anything from general fatigue, irritable bowel syndrome. We treat hypertension, high cholesterol. So there's a wide variety of chronic illnesses that we can treat too using acupuncture, Chinese medicine, naturopathic diets, mind-body. So we use all these therapies to help keep people well.
There seems to be a lot of interest in alternative therapies here in Oregon. Why do you think that is?
Several reasons. I think Oregonians are very progressive and very proactive about their health. They're looking at every avenue to help with their wellness. And the other reason is we have a lot of colleges here in alternative medicine. So we have the chiropractic college, we have the naturopathic college, we have a couple massage schools, and we have the Chinese medicine acupuncture college here in Portland.
And OHSU works with those colleges?
There's a strong collaboration between OHSU and all these colleges. This is a very unique situation in Portland. I think it probably is the only case in the nation where this exists.
So do you find that young physicians who are going to school, who are going to be our next generation of providers, do they gravitate towards training in that area or learning more about that area?
I think there's a general increase in interest in integrative medicine and alternative medicine with the new doctors or the new medical students coming in. I myself have had several fellows and medical students who have come to observe in the integrative medicine clinic because of interest. The family medicine department has a fellowship for their residents that has a specialized track in integrative medicine.
And your particular area of expertise is naturopathic medicine. So can you define that for us?
So naturopathic medicine, my definition of that is that the medicine believes that we all have an innate vitality that can aid us in wellness. And what naturopathic medicine does is it enhances that innate vitality that we all possess to create better wellness or balance.
OHSU is really a leader in this area of integrative medicine. So where do you see the future of this going, or how do you see it expanding?
So I think the future of integrative medicine is that it will expand. There's a consortium of academic health centers or medical schools that all have integrative medicine programs, and there are 50 of them across the country, and OHSU is one of the 50, a part of this consortium. I think the fact that we have a lot of medical schools in the country that promote integrative medicine, have integrative medicine, kind of shows that this is of interest and will be expanding.
So when a patient gets these varying types of care, is there like a central manager who kind of oversees everything and oversees the patient's best interest?
Right now at OHSU, the central manager would be the primary care physician. In the integrative medicine clinics that I work in, most of my patients have a primary care physician who oversees everything. And then I work on the naturopathic care, and we communicate together to help the patient out.
Yeah, so it's good that you guys are always talking and
Right.
you're in the same, OHSU family, so you can access the records and talk to each other, right?
Right. That is hugely popular with the patients. I cannot tell you how many patients tell me that the fact that we're all communicating really makes them feel better. It decreases stress because a lot of patients feel that they feel stress around telling their conventional doctor about the alternative medicine and not knowing what to do. And when we tell them that we're all communicating about this, it's just a big stress relief. And they really feel that all of us at OHSU are really looking out for their best interests and working together to help them get better.
And a patient might not realize that these alternative medicines are out there, and their primary care physician might be able to recommend that since you guys all work so closely together.
Right. The other great thing about the fact that all the providers are communicating around this is that I also get communications from providers who don't know about an alternative therapy and who will ask me what I think. And I think that's a great bonus because we can communicate about therapies, and then the provider can be more informed about some of the alternative therapies that their patients are using.
If people are interested in integrative medicine at OHSU, how can they get in touch?
So we have 3 strong integrative medicine clinics at OHSU. One is at the Center for Women's Health, and the Center for Women's Health website has the integrative medicine team on their website, or you can call them. We also have the Neurology Wellness Clinic that also delivers integrative medicine for people with neurologic disorders, but that includes people with migraine headaches. And then there's also the Family Medicine Clinic at OHSU that delivers integrative medicine.
And of course, you can always call the main switchboard at 503-494-8311, and they can get you in touch with the right person. And all this information is on the OHSU Effect page on KXL.com. Dr. Lynne Shinto, thank you so much.
Thank you, Lacey.
And coming up next on the OHSU Effect, we're going to talk about robotic surgery. That's in just 5 minutes on FM News 101.